November is the Diabetes Awareness Month, and that for that reason we shall be having a little talk on diabetes. So we shall be looking at type 1 diabetes. We have various types of diabetes, for example, type 1, type 2, and even gestational diabetes, which occurs during pregnancy. So make sure you join me till the end. So welcome back, good people, to Community Medicine, a channel where we discuss matters health. If you're seeing this face for the first time, do not hesitate to kindly subscribe, to like, and to share this video. And to all my subscribers, my viewers, thank you very much for your support. Let's keep doing this. So type 1 diabetes is also referred to as juvenile diabetes. And this is because commonly it occurs in childhood, but it can also occur in young adults below the age of 5 years. So what really happens is that the pancreas is not able to produce enough insulin or doesn't produce any insulin at all. And this could be due to destruction or damage of the cells that are found in the pancreas. These cells are responsible for production of insulin. So what is insulin? Insulin is a hormone which actually allows glucose in the bloodstream to get into cells of the body. So our bodies are made up of cells, and these cells need glucose for them to function normally. So when we consume food and the food is digested, the end product is actually glucose. So this glucose will be found in the bloodstream, and it's the duty of insulin to regulate this glucose and to allow this glucose to get into cells of the body. So in type 1 diabetes, we find that if there is no insulin, it means that the cells will not be getting glucose, and it also means that there will be accumulation of glucose in the bloodstream, actually up to dangerous levels, which can bring about various complications. So we have some risk factors to type 1 diabetes, for example, family history. So if you have a parent or a sibling who has diabetes, you are at a more increased risk of getting diabetes. But this doesn't mean that if you have a family history of diabetes, you have to get diabetes. No, rather it means that you are at a more increased risk of getting diabetes compared to someone who doesn't have a family history of diabetes. We also have a genetic makeup. So various genetic makeups can predispose us to getting diabetes. So there are various signs and symptoms to look out for, either in your child or in you as a young adult, to ensure that this is not diabetes. For example, unexplained weight loss. So you may find that your child or this young adult has started losing weight despite eating normally. So this could be due to diabetes, because remember we said that the cells need glucose for them to function normally. So if the cells are not getting adequate glucose, it means that the body will look for an alternative way of getting this source of energy. So what really happens is that the body will break down muscles of the body as well as parts of the body. So this would in turn lead to unexplained or to weight loss. Something else is a frequent passage of urine. When there is a lot of glucose in the bloodstream, it means that there'll also be a lot of glucose in urine, and this would lead to pooling of more water, which in turn would lead to a lot of urine or a lot of buildup of urine. And this would mean that this person will keep passing urine frequently. So when this person keeps passing urine frequently, they will need to replace the lost fluid. So they'll keep drinking more water. So excessive dust is also another sign of diabetes. So if your child keeps asking for water more than the usual, or if this person keeps drinking a lot of water, so that could also be a warning sign of diabetes. Something else is feeling exhausted or a lot of body fatigue. Remember that the cells are not getting glucose as a source of energy. So this person will be feeling exhausted all the time, or this child who was previously very playful, very active, suddenly doesn't want to play, or when they play just for a while, they get tired and they just want to rest. And also you may find that this child who was previously not wetting the bed has suddenly started wetting the bed. So you also need to look out for this. And then there is also blurred vision, or not being able to see clearly. And this would happen due to accumulation of glucose in the lenses. And then something else is excessive hunger. You find that this person wants to keep eating or to keep snacking all the time. They are feeling hungry all the time. This also is a symptom of, could be a symptom of diabetes. And then there is also mood changes and irritability. This child or these young adults get irritable easily. Yeah, so all those could be warning signs and symptoms of diabetes. But remember, we always say that there are various signs and symptoms which could be similar, or this condition would present with signs and symptoms that are similar to another condition. So until you get checked, you may not be able to be sure that this is really diabetes. So visit your doctor, and your doctor will perform various tests on you. For example, a random blood sugar test. Just like the name suggests, it is a blood sugar test that is performed at any time of the day. So a random blood sugar test of 11 or more millimoles per liter would be considered to be high. And another test is a fasting blood sugar test, which is normally performed after 8 hours of fasting or having not consumed any food or any drink. And a fasting blood sugar test of 7 millimoles or more would also be considered to be high. So majorly management of type 1 diabetes is with insulin, and that is another reason why it's also, called, besides being called juvenile diabetes, it is also referred to as insulin dependent diabetes, because majorly insulin is the main management of type 1 diabetes. So your doctor will demonstrate and guide you on how to inject this insulin if you're the mother of the child or if you're the young adult, on various parts of the body. Yeah, so another very important way of managing diabetes is through diet. So a diet that is high in fruits, greens and vegetables, and low in carbohydrates, especially the refined cereals. So it's advisable to use the whole grains. For example, the brown bread, the brown rice, brown chapati, and the maize flour that is not refined, or rather ile ya kisiagi. This will help you to control the sugars, and this will reduce chances of the sugars spiking. So for a plate of a diabetic person, mostly we normally divide the plate into two, and one half will have either vegetables or greens, and the other half will be divided again into two. One quarter will have proteins, which could be cereals like legumes, maybe beans, lentils, or even meat, and then the other quarter will have the carbohydrates, which is what we've talked of, like the whole grains. You can even have other carbohydrates like maybe sweet potatoes, arrowroots. Yeah, so also it's important to keep checking your blood sugar levels. So also incorporate plenty of fruits, plenty of water in your diet, and also ensure that you avoid being hungry for long, because your sugars may go down. Keep checking your sugar levels to avoid them going so high. I talked of low blood sugar levels, high blood sugar levels, and even demonstrated on how to check your blood sugar levels. So you can revisit those videos, they'll be of use. And also you can join support groups so that you encourage each other on the management of type 1 diabetes. Thank you very much for watching. Bye.